2,388. The worst hit states across the country, including Maharashtra, a total number of cases now stand at 3,323, while
265,227 people have tested positive. That's an increase of 2,004 cases since yesterday.
Ini 125 kes baru dilaporkan, menjadikan jumlah keseluruhan ialah sebanyak 553 kes. Tiada sebarang pesakit yang telah discharge ataupun pulih sepenuhnya hari ini, dan sehingga kini seperti yang Cynthia sebutkan, 12 kes positif sedang dirawat di ICU dan
In today's video, we will be discussing the current COVID-19 pandemic construction-based issue that will be affecting some changes on site. As we all concerned, we have seen multiple cases in our country or even in others involving construction personnel infected while carrying out their work on site. This issue is giving a great impact on sustainability of construction industry economy. Due to the new progress our country made, the time have come for us to not delay the situation any further. Based on that, our members of the group will be explaining the steps, strategies, and the best practice that can be used to control and contain the COVID-19 virus from spreading within the construction.
First of all, in May 26 this year, there are many news and articles came out about the cause of COVID-19 among the construction site workers. But in this case, the construction site laborers are mostly foreigners and they can only afford to rent a house if they share the space with at least 10 people. Because of this, they can't practice the social distancing. Next, the laborers also don't prioritize cleanliness at construction sites. They need to make sure the cleanliness of themselves, the tools and the material they will use before starting their job. Furthermore, construction projects require a long time period to finish. So, the laborers have to work for 8 hours or more. The possibility to COVID-19 will disperse is higher when they are working together for more than 5 hours.
The effect of COVID-19 cases not only occur in construction site but also around the world is first how the human behave when this pandemic occur in this world. First, when they do the panic buying, they can lead the spreadness more easier. Why? Because when everyone isolated in one small place, there are no social distancing, and also the hygienist of the customer in the grocery or also the store, that can lead the COVID-19 to spread more easier. Number two, when the people are too stubborn to follow the SOP and also procedure that being promoted by the government. I give an example in the United States. The increase of the cases are because the human they behave. They don't want to follow the procedure and also SOP. And number two, when the social media play fake news and also fake fact that can make people become more panic and also frightened to go outside and also do their daily life, and this may lead into the dropness of our economy and also how we behave in our daily life.
Okay, now I will talk about the negative effects of strategic control of COVID-19 in construction site. Okay, so one of the negative effects of strategies to control COVID-19 in construction site is the additional cost to ensure the safety and infection-free of the construction site from COVID-19. Okay, so the employee needs to supply their employer on medical product care to prevent the spread of COVID-19, such as sanitizations and cleaning works. So employee needs to bear the cost for all employers' COVID-19 tests, so they will know workers that are having COVID-19 during their works have started. So as the implication, some employer may not follow the SOP provided and can cause higher chances in spreading COVID-19 among the site worker and site visitor.
After the government open the development sector, everyone will be returned to work to revive the economy which is affected due to COVID-19. Thus, the government has directed every company return to work, but they need to follow the SOP given. For example, all workers should undergo pre-employment health screening before they go to the site. This will give a positive effect to everyone when everyone come back for work. Some of positive effect are it can improve the economic sector for the workers, employer and country. For example, a return of employer for construction work can help a company to gain more money, and this will also prevent the company from bankrupt.
Complete prohibition of movement and large gathering across the country. Complete restriction on all overseas travel by Malaysian. For those returning from overseas, they are required to undergo 14 days self-quarantine. Complete restriction on all tourists and foreigners entering into the country. Close of kindergarten, nurseries, government and private school. Close of all public and private higher education institutions as well as skill training institutions. Close of all government and private premises except those involved in providing essential service including. He said the order of control of the movement involved the first total ban on public movement and gathering through the country including religious, sport, social and cultural activities. Certain areas in Malaysia are subject to strict orders using the Stabilised Movement Control Order or PKPD. Malaysian for all walks of life affected by the COVID-19 outbreak will receive and can apply for the various assistance and initiatives outlined in the government announced economic stimulus package.
Maintains a series of econometric models that are used to produce estimates of labor market, obtain a possible range for the number of employment impact of the virus. This study proposed three potential scenarios: low, mid and high scenario. Okay, low scenario where GDP growth drop by around 2%. Global unemployment will increase by 5.3 million with uncertainty of 3.5 to 7 million. Mid scenario where GDP growth drop by 4%, global unemployment will increase by 13 million. On the high scenario where COVID-19 has serious descriptive effect, reducing GDP growth by around 8%, global unemployment will increase at 24.7 million with uncertainty ranging from 13 million to 36 million.